that there is a compressive element. So this is the front of the abdomen here. This is the back here. And this is a cross section, or what we call an axial cut. This is a normal spinal canal with the nerve roots or spinal cord in the middle. And this is called the spinal foramen. And here you can see that there is compression from behind and also in front on the spinal cord or nerve roots, depending on which portion of the skeleton that you're in. Treatment for this can be a laminectomy or partial laminectomy to shave this bone. And often people describe it as a roto-rooter to remove some of the bone or take away some of the ligament to open up some of the canal. And in some cases, patients will need a spinal fusion depending on what other disease they have. Spondylolisthesis is an area where the bone is slipped forward. And you can see here that this bone is slipped a little bit forward on this one. And some people have a fixed spondylolisthesis, and some people have a mobile spondylolisthesis. When someone has a mobile spondylolisthesis, it's an indication that not only does a laminectomy need to be performed, but most likely a fusion should be performed as well, as the chance of causing instability after a partial laminectomy is increased. Additionally, you can see in this patient, there's a loss of height. And not only is there a problem within the center canal, but there's also a problem with the nerve roots exiting. And without proper alignment and restoration of height, the patient will not have the best outcome. So a laminectomy or partial laminotomy has to do with basically shaving some of the bone. So here we have a picture of the spine as we see it from behind. And what we've done is here is shaved and removed out the whole portion of the lamina. Now it is rare that I need to remove the whole lamina. I only make a window in the area that is narrow and use a microscope to minimize the surgical procedure to gain the best outcome that we can with the least amount of damage in order to increase the patient's ability to ambulate early and decrease the recovery time. Here, this is a laminotomy, which is a small window that's made just on one side. This can be used because there's just compression on one side. This can also be used in the case where a person has an acute disc herniation, and that acute disc herniation is causing a problem and we need to enter the canal from a certain portion. And so the laminotomy is used to open up the canal. We shift the nerve roots out of the way and we take out that fragment of disc. Here we have the idea of a microdiscectomy. So this is what I was just speaking about in terms of a laminotomy. If a person has an acute herniated disc without narrowing in the other portion of the canal, we can do a small laminotomy, move the dural sac out of the way, and you can think about my eyes here and the working area here, and just shaving a small portion of the disc and a small portion of the bone here in order to open up the canal. This is often allows for early mobilization, walking on the day of surgery, and in some patients is appropriate for outpatient surgery. Here we have multiple different diseases that can occur within the spine. So we have different types of spondylolisthesis. So you can see here is that this is that slip that we were talking about. And once again, this can be a fixed slip or it can be a mobile slip. This is a grade 2 spondylolisthesis, which is divided into 4 or 5 grades. And it is pretty severe. And I would expect, without seeing even an MRI, that the patient would have severe symptoms with what we call neurogenic claudication, which is associated with spinal stenosis. This would most likely come with complaints of pain radiating down the leg and with complaints of difficulty ambulating any sort of distance.